Hi, I am Dr. Vibhor Borkar. I am Pediatric Gastroenterologist, Hepatologist and liver transplant physician practicing in Mumbai and Western India. Today, we'll be discussing on a very important aspect of child's health, that is Irritable Bowel Syndrome, also called as in short like IBS. And remember, IBS and IBD, they are two different entities. There is a common perception that IBS means Irritable Bowel Syndrome is only limited to the adults and it doesn't happen in children at all. But today the world has changed. Even our kids, they have a lot of stress, and even kids as young as 9 years and 10 years, they can also Irritable Bowel Syndrome. So let's dissect this out, this entity, what's an IBS in context of children's health. So what is Irritable Bowel Syndrome? Irritable bowel syndrome is a functional gut disorder. Now, what does it mean? When we say as a functional gut disorder, it means that when we investigate for any complaint, we do not get any test positive, which may be simple blood test or ultrasound or even endoscopies and CT and MRIs of the abdomen. But the intestine or gut is not the functioning the way it should, and that's troubling our kid. That's how we call it as a functional disorder, and it is called as IBS. Now let's see what are the symptoms of IBS. The most common symptoms are stomach pain, there can be a bloating, flatulence, can be a diarrhea or constipation or even both, which can alternate each other, and the pain which doesn't get relieved even after passing potty. So these are the very common symptoms. But does it mean that whenever these symptoms happen, it's only IBS? No, it's not like that. Many of these symptoms can be common or overlap with even many serious illnesses also. So just by these symptoms, we cannot come to the conclusion that your kid might be having an IBS. So what you have to do is, you have to look for any other red flags also. So what are these red flags? Most important thing, that despite all these symptoms, your child should be growing well. There should not be any weight loss. Other important red flags are child getting up in the night, there is a blood in the stool, child is vomiting a lot, fever. So these are the certain symptoms where they do not fit with Irritable Bowel Syndrome. So how to diagnose it? First thing, when these symptoms are there, you need to contact a GI specialist. Preferably if you have a pediatric GI specialist around you. Your doctor will run few tests, simple tests, to see that we call as a screening test. Means they will indicate if there can be a serious problems or not, and of course before that they will take a detailed history and a detailed examination, and then may conclude if there is an Irritable Bowel Syndrome or not. In rare instances, even colonoscopy is required because the symptoms can overlap and mimic other serious gut disorders. Most important part is rescheduling your lifestyle, routine, and managing the stress. So diet, very important aspect of the management. So avoiding a lot of fruits, junk food, having a healthy and the complete diet is very important. In today's era, having an active life is very important. So your kid should be involved in at least 1 hour of daily exercise. If it's not possible, at least on the weekends, he should compensate for the remaining days or remaining duration of the exercises. Then managing stress, avoiding watching too much of a screen. It can be a TV, tablet or mobile. Also avoiding staying awake for a late night. So they should go to sleep early and they should get up early. Talk to a kid, try to see what are the stressful events they are having, elevate their anxiety. This is very important. So together we can help our kid to manage their stress, anxiety, have a normal routine, and slow down their tummy problems, and that's called an IBS. So with all our collective efforts, we can manage IBS. So if you like this video, please like it and forward to a person who needs it. And don't forget to subscribe my channel for more informative videos. Thank you.